I am here with my dear friend Buzz the Bee from Busy Bee Plumbing, Heating, and Air Conditioning. You are going to want to keep a close eye on the weather today, am I right? And let me tell you, it's time now for your local weather report, brought to you by Busy Bee Plumbing, Heating, and Air Conditioning. Let's buzz on over to the Main Street Media TV Weather Center.
From the Tennessee Valley Weather Channel, this is your weather on Main Street.
Good morning to you, and thank you for watching Mornings on Main Street. I'm Ben Luna from the Tennessee Valley Weather Channel, coming to you this morning from the Home Weather Center. Across Middle Tennessee today, temperatures remain on the warm side. In fact, very mild as we head into this almost the last week of October. Got a few more days here next week, of course. But overall, it is on the milder side here for today and tomorrow, and probably Wednesday before temperatures make just a little bit of an adjustment here for the midweek. I'll show you that here in just a second. Your futurecast as you step through the course of your Monday looking pretty good today. We're going to wind up seeing just an overall sunny sky, but we are bone dry across the area with a light breeze as well. Anything that does occur will be in from the northeast to east direction as far as wind goes. And then as we work our way into Tuesday, not much is changing. Still partly cloudy and fairly warm. Many of you in the upper 70s to near 80. I think those 80s will be more prevalent as you head toward the southern half of Middle Tennessee. 81 here for tomorrow, 83 on Wednesday. A little clipper system passes the region Wednesday into Thursday. I think that's more clouds for everybody and just a very small chance for a backyard shower for a few folks north of I-40. Looking ahead to a Thursday morning, and then that's out of here and gone. Our temperatures go down, and then we rebound right back up as we look ahead to the coming weekend. That's a check on your forecast here on Mornings on Main Street. Thanks so much for stopping by. Have yourself a blessed Monday. Always check out the latest forecast at tnvalleyweather.com.
Thank you for that update. Tune in each day on Mornings on Main Street for an up-to-date weather report brought to you by Busy Bee Plumbing, Heating, and Air Conditioning. All of their contact information is below. Have a great day.
Good morning, Stefanie.
Good morning. Hi, kids. Hot tea.
Welcome to Mornings on Main Street. I'm your host, Stefanie Miller. Thanks so much for joining us this morning. We hope that each and every one of you had a fantastic and enjoyable weekend. Well, pink is the color for October because October is Breast Cancer Awareness Month. Coming up this Saturday in Rutherford County, you have Wine Around the Square, where all proceeds go back to Ascension Saint Thomas Rutherford's Foundation Power of Pink Fund. This fund is there to help support the women in underserved communities here in Rutherford County, making sure that they have access to mammograms and screenings. It also helps to support the mammography tour bus that travels around to 26 counties in our state. I'll have some incredible numbers from the Power of Pink Fund and exactly how many people they've been able to help or how many screenings this fund has provided. We'll have that for you at the end of today's show. But for today, our segments will include the following: a talk that I was able to do last year with Dr. Lindsay Keith. She is a breast surgeon here in Rutherford County. She will share with us the different types of treatments for women going through breast cancer. We will also hear once again today from oncology nurse navigator Kathy Pierce. She is with Ascension Saint Thomas, and she has worked with breast cancer patients for a number of years, helping them get through their breast cancer journey and navigate through some pretty difficult times. So we are sharing those interviews with you once again today on this Monday to start off our week. Now later on in the week, we will hear from the honorees for this year's Wine Around the Square. But again, that'll be Wednesday. So stick with us for today on this beautiful Monday to hear from Dr. Lindsay Keith and oncology nurse navigator Kathy Pierce. But first this morning, let's get a check of our headlines.
Hello, here's the latest news and weather from Main Street Media TV. Assurant inaugurated its new Innovation and Device Care Center in Mount Juliet, simultaneously announcing a $100,000 grant to Middle Tennessee State University for a planned engineering lab slated to open next fall. The Boys and Girls Clubs of South Central Tennessee raised $313,000 at its 25th annual Great Futures Gala, funding to enhance its youth programs and waive all team membership fees. Lebanon's young racing sensation, Dawson Sutton, is set to compete in the full NASCAR Craftsman Truck Series next season, following in the footsteps of late Wilson County champion racer Bobby Hamilton. Tennessee Wildlife Resources Agency officer Montana Mitchelson, who patrols Old Hickory Lake, has been honored as both the Tennessee and Southeastern Regional Boating Officer of the Year. Michael Romans, a K-9 handler at the Rutherford County Sheriff's Office, retires from duties with his 10-year-old bloodhound, Georgia, after locating countless missing people over a 13-year career. For more news and weather, visit us online at mainstreetmediatn.com. Thanks for watching.
So Busy Bee is a very close-knit family. We fight just like every family does. We have arguments, but we always come out with a solution to the problems. We don't just fight about what we want, we fight about what customers need. We want to make sure that every customer we go to is more than satisfied. And that doesn't just start whenever we show up at their door, that starts when we show up every day at work. We want to make sure that we are serving our customers to the best of our ability.
He shoots, and he scores!
Being a part of a cooperative is being a part of something bigger. Farm Credit Mid-America is a customer-owned lender that specializes in agricultural financing for farm real estate, operating, and farm equipment. A unique benefit of being a part of the Farm Credit Mid-America Cooperative is our patronage program, which has put over $1 billion back in our customers' hands over the last 7 years. That's the power of a cooperative. Visit us at fcma.com to learn more.
I own the land.
I farm the land. Together we're farmers. This is our cooperative.
So looking at statistics, 1 in 8 will be diagnosed with breast cancer, 2 out of 3 women after the age of 55. We're sitting down with Dr. Lindsay Keith, who has been a breast surgeon now going on her 7th year of residency. First off, thank you so much, Dr. Keith, for your time.
Absolutely. Thanks for having me.
Right off, what are some of the risk factors for women as they get older?
Okay. In general, the biggest risk factor is being a female, of course. So 1 in 8 women, as you mentioned, are going to deal with breast cancer. So that's why it's very important to know your own breast, also know what your other risk factors are, which I'll talk about, but also make sure you self-examine, which we'll also talk about. So risk factors, mainly, most people think of family history. While family history is certainly a risk factor, not everybody with breast cancer has a family history of breast cancer. So there's a lot of misconception there. But really estrogen exposure in general. So starting periods at an early age, having hormones after an average age of menopause, which is 51, estrogen exposure in general in that aspect, never having children or never carrying a child to term is actually a risk factor as well. Excessive alcohol use, and of course, again, family history is where we look into it as well.
Wow. Okay. Yeah. Then let's talk about self-examination and when that should start and exactly what you are looking for.
Yeah. There's no great guidelines for when it should start, but in general, my recommendations are to know your own breast, because I have women that are girls really that come to me at 16, 17 that have masses and they found them themselves. Now, most of the time, 16 and 17-year-olds aren't doing regular breast exams, but certainly by the time you're in your early 20s, you should know kind of what's normal for you and what's not. So lumps, bumps, masses, anything that's new and not going away after about 2 weeks would be concerning. Pain is actually very rarely a sign that something bad is going on. So one of the most common things I see is breast pain. Well, good. I always say good. You have breast pain because that's rarely a sign that something bad is going on. really I can count on one hand how many times pain has been so associated with a cancer diagnosis. So that's not really a sign of cancer, but it certainly gives people reason for concern, and they, call their doctors, go to their doctors. But it's really masses that are sort of fixed or stuck to the surrounding tissue, masses that are sort of mobile or kind of move underneath your fingers or are smooth, are usually cysts or a benign tumor called a fibroadenoma. They're not usually a cancer diagnosis in those cases. So it's really just knowing your breasts. On average, I usually recommend people examine them once a month, because if you're examining them every day, you might not notice changes. Just as if you see somebody every day, you're not going to notice weight loss. As if you see them once a month, you're going to notice some changes over time.
Right.
So once a month in the shower is the best place to do it, because let soapy water be on your skin. It kind of helps things slide a little better, so you can see if they're mobile. You can see if they're fixed to their surrounding tissue, things like that.
I don't know about others, but my first initial reaction would be a little panic if I felt something.
Absolutely.
What can you say to women who are doing those self-exams, or they say they get that diagnosis of breast cancer? What can you say to them?
For the women that does a self-exam and finds a lump, don't delay. 2 weeks is a long enough time for something not concerning to go away. A cyst related to your cycle will usually get smaller or less prominent after about that 2-week time period, or even a month. But if you feel something and you're concerned at all about it, don't ever hesitate to go to your doctor, primary care doctor, urgent care, wherever you can go to sort of have yourself be heard about, hey, I found this thing, what do I need to do next? And then the next thing that you should do, depending on your age, is some sort of imaging. If you're less than 30, that imaging is usually going to start with an ultrasound. If you're over 30, that's usually going to start with a bilateral diagnostic mammogram plus an ultrasound on the side that you're feeling something. So bilateral, both sides. Diagnostic, they're looking for something. And then again, the mammogram is usually combined with an ultrasound. And that's the best way to sort of first look and see if there's anything bad. And a lot of times what happens is women do that, and then they find, oh, well, you've got a cyst, you're going to be fine. And then you can have some, pause for concern, or less reason for concern. And then sometimes you'll still get established with a breast surgeon at that point, because if it's symptomatic, meaning it's painful or it's growing, something like that, we can still do some things for that. But after you get a diagnosis, again, of course, now it's game time, as I call it. Now we have a diagnosis. Now it's time to go through all of the steps to figure out the things that we need to do next.
At Delta Dental of Tennessee, we know our success begins and ends with providing superior quality service, and that includes serving those who need it most. This year, we're celebrating 25 years of giving back to the community we call home. Delta Dental, along with our Smile 180 Foundation, supports Tennessee's dental colleges and oral health education, children's hospitals, free and reduced cost dental clinics, and other like-minded charities. Here's to the next 25 plus years of ensuring healthy smiles.
Step into the Lionel retail store at Opry Mills, Nashville, and you'll be captivated by all the magic of the 123-year history of Lionel trains. Whether you're already a train enthusiast or just getting started, Lionel will energize your love for trains. NASCAR fan? Come check out your local Lionel station to learn all there is to know about model trains and die-cast NASCAR collectibles. Visit nashville.lionel.com or call 615-455-9399.
Welcome back to Mornings on Main Street. I have Kathy Pierce with me now. She's been a nurse for 40 years, recently celebrating 40 years. She works as an oncology nurse navigator. First off, Kathy, thank you so much for your time.
Oh, you're welcome. Thank you.
What is a navigator? What is that role?
I am here for the patient, and I'm here to help them with anything that I can, help them anything that they need. If they come up with any problems, questions, kind of start with them from diagnosis and try to be with them when the doctor talks to the patient about what's going on initially, and that kind of helps form a bond. Right. And then I can kind of assess what needs they may have at that time. That's an ongoing process that changes all the time. We call them barriers to care. So that is one of my jobs, is to remove barriers for the patient. So financial, emotional, education, lack of knowledge of actually what's going on, even though the doctor explained it to them. Some people still don't quite understand it.
It's a lot.
It is a lot to take in at one time. Yes, it is.
Well, how long has the navigator role been around, or has it been called something different in the past? Has something like this always been available to patients?
No, this is new. This is new. I've been doing this 5 years, and I think that they had one other breast navigator at Midtown at that point. They didn't have any other navigators at that time. So they quickly hired GI, lung, and brain.
Okay.
So we cover a lot of diseases. There are still some that don't have navigators that we see a need for us to have more navigators because it's essential. I'm here for the patient. If you have a question that you don't feel like you need to call the doctor, you can just call me. I tell them, call me. I don't care if you called me yesterday. If you have a question, you call me. If you have a problem, you call me, and we'll do everything that we can, as I said, to remove the barriers to help the patient out.
So again, being a nurse for 40 years, you saw what this was like before, having someone in a role as a navigator. And now that there is someone here, I guess, do you see a sense of relief when it comes to working with those patients or those family members?
Absolutely, absolutely. They were like, oh, I can call you. I'm like, here's my folder and here's my number, my card right here inside the folder, securely, so that they won't lose it. I tell them, please call me if I can do anything for you.
That's beautiful. That is beautiful. Kathy, can you tell us what resources and programs are offered to help patients, breast cancer patients, as they go through that journey through treatment and through care?
We have a lot of resources. We're really blessed with resources. We have had grants from different organizations, including the foundation. They give us gas cards for transportation for patients that live in outlying areas and are needing to come to radiation, every day.
Okay.
We also have, gosh, we have so much. Where do I start? We have a support group. Okay. We have a virtual support group. We have it's a women's group, and then we have a men's group, and then we actually have a caregivers support group. And then also we have a post-treatment support group that is for patients after surgery that maybe have to have scans every 6 months or something, and they're kind of very worried. So there's also a group for that. And our social worker or the psychiatrist from Tennessee Oncology, they work the group. So we have very qualified people there to help them.
Talk to us about support groups. Do you have times to where patients are like, I don't need that support? Why should they maybe turn to a support group as they're going through their journey?
Because people have said that when they're around people that are going through the same thing, it is so helpful. And it's kind of sometimes just getting them there and being open-minded enough, because they are so stressed and really kind of freaked out, because I don't know how many patients have had to say to me, I can't have cancer. I feel too good. There's no way I have cancer. And that's very, very hard for them, because those people are still not really accepting it.
Right.
And it's a grief process, kind of like with anything, that patients go through, just like any other grief process.
So right here at the Square in Murfreesboro, this is where Wine Around the Square will happen this Saturday. It'll be in the afternoon and evening. We'll have ticket information for you on Wednesday. Also on Wednesday, we'll hear from this year's honorees of Wine Around the Square. That is Dr. Nick Tarola and his wife, Adrian. You'll learn what work they've done here for the Rutherford County community, how they've given back to breast cancer patients in this area. I cannot wait to share my sit down with them on Wednesday with all of you. I would like to share a couple numbers though for you. From the Power of Pink Fund, this fund has raised over $2 million. It has also helped to make sure that 24,000 mammograms and screenings have taken place for women who needed it. We'll have more information for you on Wednesday. The last thing I can say this morning is, for women out there, make sure that you get your annual mammograms. It is not just something that you need to do, but it is necessary, important, and could be a life-saving measure for you. Thanks for joining us here at Mornings on Main Street. We look forward to seeing you back here tomorrow morning.